This is Chapter 5, Integumentary System. Obviously, with the integumentary system, we're going to talk about the skin. So the skin covers all outer surfaces of the body, and it's composed of two layers. The first layer being the epidermis, which is the outermost layer of skin, and the dermis, which is the layer of skin underneath the epidermis. Accessory organs of the skin are the hair, which is composed of the shaft, the root, the follicle, and the papilla, which you'll have to do an exercise on the CD-ROM where you drag and drop the combining form with the appropriate structure. The glands, we have pseudoiferous or sweat glands, which are responsible for keeping us cool. When the body gets heated, then we excrete sweat, and then as the sweat evaporates, that is the means of cooling the body. We also have sebaceous glands or oil glands, and these are responsible for excreting sebum or oil onto our skin to keep it moist so that it does not become too dry and cracks. Certain conditions like psoriasis, certain thyroid disorders can cause excessively dry skin, so we definitely need the sebaceous glands to excrete enough to keep the skin integrity good so that there's no cracking. Now, a lot of patients in the winter will experience dry hands and feet and skin, and they have to supplement with hand cream and lotions and that's pretty normal. Then there's also the teenagers who are going through puberty where they have overactive oil glands, and that leads to acne and blackheads. The nails then are also an accessory organ of the skin. The lunula is a crescent-shaped area, white area near the root of the nail bed. So if you look at your thumbs, you should probably see the lunula most present on your thumbs. Sometimes you can see it on the rest of your fingers, but not always. It depends on if you push your cuticles back or not. Pathology that we see of the integumentary system: skin lesions. Skin lesions are areas of tissue that are pathologically altered by an injury, a wound, or an infection. Now, your book talks about systemic and localized. These two terms are not specific to the integumentary system. They can be used in any fashion throughout the body, but systemic is a term that is used to describe something that's widely spread throughout the body. Localized is confined to a specific area. So a systemic infection, if you will, is an infection which is throughout the body. So basically sepsis, and sepsis is when microorganisms invade the blood supply, and the blood is pumped to all portions of the body, so that is a systemic infection. Localized then is confined to a specific area. So let's say that you fall down and you have an abrasion on your knee, and some dirt or whatever got in it and it got infected. So that is a localized infection confined to that specific area of the injury. Burns then are thermal injuries to the outer surface of the body. Now, that talks about thermal injuries, but burns can also be caused by chemical agents, contact with chemical agents, and also electrical burns. But we typically think of thermal burns as being the most common. So a thermal injury to the outer surface of the body can result in a first, second, or third degree burn. A first-degree burn is where the epidermis is damaged. Symptoms are erythema, which is the medical term for redness, and hyperesthesia. Esthesia means sensation or feeling, and hyper means excessive. So you have an excessive sensation or feeling, which is not a good one. So this could be contact with scalding hot water, which would result in a first-degree burn. Second-degree burn then is classified as erythema, hyperesthesia, and also the formation of fluid-filled blisters. So this burn will damage both the dermis and the epidermis, so just the layer right below the top layer of skin. A third-degree burn then is the most severe, and that is burning of both the epidermis and the dermis, and it goes quite deep. There will typically be tissue lost during a third-degree burn. It results in a scar, and it may need dermatoplasty. Plasty means surgical repair, and dermat means skin. So they may have to have a skin graft done, where they take skin from another area of the body and bring it to the damaged area and place it on it to heal. Typically, skin grafts are taken from the lateral portion of the thigh or the upper buttocks region of a patient. Oncology that we see of the integumentary system. Now, the terms malignant and benign are not specific just to the integumentary system, but your book talks about them in this chapter. So the term malignant means when a tumor is invading normal tissue, it's cancer. So it's cells that are dividing that are not good. If that malignant tumor continues to divide in cells and get larger, it could also potentially spread to other parts of the body by seeding, if you will, to another portion of the body, not necessarily spreading to area that's adjacent to it. So let me give you an example. Lung cancer is a primary cancer, and we know through studying lung cancer that it metastasizes to the brain. So those two aren't physically touching each other, so you can see how the cancer can seed to another area. Another example would be breast cancer. Breast cancer is a primary source, and it will seed or spread, metastasize to the colon. Benign, then, is the term that's used to describe a non-cancerous tumor. So you can have a tumor and it not be a problem as long as that benign tumor is not getting larger and causing any problems with function of the organs or cells around it. Sometimes patients can have non-cancerous tumors that are never removed and never change. And so a benign tumor is definitely the one you want as opposed to a malignant with metastasis. Basal cell carcinoma is the most common type of skin cancer caused by the sun. It is slow growing. It typically affects patients that have fair skin, that are light colored eyes, like blues and greens, and are blonde or redheaded. So those are the patients that are more predisposed to a basal cell carcinoma. Squamous cell carcinoma, then, is a tumor of the epidermis. There's two types. There's in situ and there's invasive. In situ is a tumor that is in position or localized to a specific area. These are typically easier to treat because if the tumor, let's say this is the tumor here, is in one specific area, depending on the location, we can typically go in and just cut that area out, do an excision or removal of that tissue. An invasive tumor then tends to spread, and so when it spreads, sometimes it will grow like these finger-like projections out from the primary site, and so it's more difficult to treat an invasive tumor. It may spread to the adjacent area, but it may also seed to other areas. A malignant melanoma is a tumor originating from pigment cells in the epidermis and dermis. Sun exposure is a contributing factor. So typically we see a malignant melanoma arise from a darkly pigmented mole. The mole may begin to change in color. It gets darker. It may get larger in size. It may begin to have an irregular border. And if those things happen, then that is indicative of a potential malignant melanoma that needs to be treated and removed. There's a picture of a malignant melanoma in your textbook on page 93, and it's between the fingers of a patient, which is an unlikely place, but nonetheless. Important terms that you need to know for testing purposes, beginning on page 93, actually it starts on 94. Alopecia is the partial or complete loss of hair resulting from normal aging a potential endocrine disorder, a drug reaction, or anti-cancer medication, or a skin disease. So alopecia is the medical term for baldness. Cellulitis is the diffuse, widespread acute infection of the skin and the subcutaneous tissue. Eczema. Eczema is a chronic inflammatory skin condition that's characterized by erythema or redness, papules, vesicles, pustules, scales, crusts, scabs, and accompanied by intense pruritus, which is called itching. Pallor is an unnatural paleness or absence of color in the skin. Now, this is not an albino, which is a lack of pigmentation of the skin, but this is like when somebody, if you've seen somebody that's ready to pass out, they typically get really ghostly white in appearance because all the blood is rushing to the vital organs. Anemia is another problem that would cause a look of pallor. If you don't have enough blood, you're not going to have good color to your face and cheeks. The term pruritus means intense itching. The term psoriasis is a chronic skin disease characterized by red patches covered by thick, dry, silvery scales. And we typically see psoriasis most predominantly on patients' elbows, knees, and around the hairline. Scabies is contagious skin disease transmitted by the itch mite, and it's commonly spread through sexual contact. And then the last term, urticaria. Urticaria is the medical term for hives. Hives are an allergic reaction of the skin characterized by the eruption of pale red elevated patches called wheals. Urticaria is, or hives are caused by medications that the body does not like, is allergic to. It could be caused by foods that we eat. It could be exposure to a chemical to the skin. And it also, hives can be caused by stress. Medical, surgical, and diagnostic procedures. On page 99, debridement is a term that is denoting the removal of necrotized or dead tissue from a wound by surgical excision, enzymes, or chemical agents. And so we typically see debridement after somebody's had a third-degree burn where they have to clean the dead area, the dead tissue off so that new growth can occur. The term biopsy. Biopsy is a representative tissue sample removed from the body at a site for microscopic examination. So let's say you had a mole that looked suspicious, and so we would send you to a physician to do a biopsy. So they would take that representative tissue and then send it to the lab for a pathologist to look at to see and determine, is this a malignant melanoma or is this a benign growth? And then skin graft is transplantation of healthy tissue to an injured area. And so we talked about that a little bit with a third-degree burn, that skin grafting may be required. Spelling words are taken from the word examples used in the word analysis. I'll go through those. Lipocele, subcutaneous, onchomalacia, epidermis, melanoma, subungual, lipocyte, xeroderma, scleroderma, and keratosis. Important abbreviations to know for the quiz on page 103. You need to know the abbreviation BX, which stands for biopsy, CA, which stands for cancer, chronological age, and cardiac arrest, but 9 times out of 10 you're going to see it used as cancer. ID, which means intradermal, I and D, which means incision and drainage, and IV, which means intravenous. You are responsible for memorizing all the medical word elements and their meanings starting on page 83 through 86. So that's where you're going to make your flashcards and go through those to memorize the meanings. Several of your quiz questions will be over these word elements. And it's important that you continue to stay on top of the flashcards and be sure that you're memorizing each chapter's word parts, because they will definitely be on the midterm exam. The midterm exam is given at the testing center at the college, and so you don't have the use of books or notes for that exam, so you're going to have to make sure that you're learning these as you go, so that you don't have to cram for that midterm. This ends the recording for Chapter 5, Integumentary System.